Well, I'm learning so much just in that commercial break from our last segment, talking with Dr. Scott Baker and two of his patients, David and Carol Pridmore. All right, this is Dr. Scott Baker from Upper Cervical Chiropractic. I always have trouble with the C's and R's, so I'm going to say this one really slow. But this is like amazing. Not only do you do normal chiropractic stuff, but you're helping people with headaches and back pain and I mean, like, the list goes on and on. Tell me a little bit about you, doctor.
Well, truly, you know, the power that made the body is the only power that can heal the body. Okay. That's why you can't put a Band-Aid on a dead guy, right?
That's true.
So
thought of it that way.
What we do is we connect the person back to the healing power, and all the healing comes from the brain. The brain runs every function in the body, and what we do is we look for interference between the brain and the tissue, and we remove it. So if the brain's not communicating to the heart, then the heart will go into failure.
Right.
It doesn't attack you. It's not waiting in a bush to jump out and get you, right? It just doesn't work, and eventually it'll stop working. Why does it stop working? Is it because you're deficient in a chemical? No, it's because the nervous system that's running it isn't getting all the information it needs, so it doesn't work properly. So what we do is we remove that, and then the body can function properly.
So someone that's sitting at home now that's like, you know what, at least weekly I have a debilitating headache, or, you know, I'm always walking around kind of holding your back like this. You don't have to keep popping the Aleve or Advil, whatever you're taking. Like, what should they do? Well,
generally, headaches are usually a vascular or a muscle tension issue. If it's a migraine, it's going to be due to the vascularity in the neck. If it's going to be tension, it'll be due to bones being out of place in the neck, causing the muscles to go into spasm. Once we figure out the direction the bone went out, we put it back very gently, then the body just heals itself. So the headaches just go away. The headaches are a signal. It's like people don't
morning, like my car when it went on this morning.
Exactly, but if you go to a doctor and a medical doctor wants to give you drugs to hide the signal, ask him if you could put a piece of tape over his oil light. You know, let's just wait till the engine starts knocking until we fix it.
So we don't want for a month or so, right?
That's right, and we don't want to do that. What we want to do is we want to find the cause of the problem, get rid of it. So I'm not managing any pain, I'm not managing any symptoms. I reconnect the body to the tissue so it can communicate and heal itself. And once it does that, the symptoms just go away.
You're a pain remover, not just a pain.
I don't remove anything. I remove the subluxation, and the body fixes itself.
I just can't believe that you could walk in and you could have had all these headaches over, and then you walk in and then you feel. And tell me how y'all got in touch with him, because y'all swear by it.
He started out going.
I started out going. I have Meniere's disease, which is an inner ear disorder, and I've had it since youth. And it's
like vertigo
very So the room's spinning around and around. It's awful, awful, awful. And anyway, I found out about upper cervical. Actually, I went to a medical professional first, and they did a procedure on my equilibrium in my left ear and left me with a feeling of being unbalanced.
Okay.
That kind of snowballed to where it reduced my appetite and everything else. And when I found Dr. Baker, I was down to about 159 pounds. Ooh. I'm 6'3".
You don't need to be that little. Yeah.
Yeah, I'm 185 now, so you can just tell what's happened.
Yeah.
But anyway, my energy level came back, my appetite came back, and what surprised me were the things that I didn't expect. My respiratory, I was breathing better. My sinuses were clear and I was breathing better. My digestive system, I was sleeping better. Everything, and here's the kicker. When I have cats, when we go out in the morning, you go out and you bend down and pick up the cat bowl and you want to take the cat food out. Yeah. And I was always noticing, oh, I got to bend over. And after a few weeks, I was going out, bend over to get the cat bowl, and I wasn't groaning. I didn't have the pain, and all of a sudden I said, where did my arthritis go? You know, I don't feel it anymore. And that was a really unexpected...
And you weren't like on medicines and stuff?
No. It was all from the upper cervical. I mean, I have no back pain, no arthritis whatsoever.
That's amazing. No. Kara, what about you? What was yours?
I was a doubting Thomas.
Or a doubting Thomas. I
was the absolute, no way can this work.
Yeah.
But he beat me down, and I went, and I was having a problem really severe with my left leg, and I thought it was my hip, and they were talking about surgery, and I'd had nerve blocks, I'd had epidurals, I'd done it all. And I just said, well, I'll try Dr. Baker to get him off my back.
Exactly, more just a shut-up husband, yeah.
But what amazed me was I went in, and it was just very much common sense. You know, the first thing he said to me was, you know, God made a perfect body. And if you treat it right and we take care of it and we keep you in line, then the body will take care of everything on its own, because God made a perfect body.
I like this guy.
And it's just wonderful. It's taken me, I mean, when I first walked in, I was limping, had trouble putting weight on my left leg completely, was in constant pain, and now I have no pain and completely got rid of the thought of surgery.
Doc, where are you located and how can our viewers get in touch with you?
We're in Spartanburg, South Carolina.
Okay.
We're at the corner of Pine and Country Club down there, and one of the ways you can get a hold of us is you can call us at our office at 864-804-6886, or you can go to our website, which is www.uppercervicalspartanburg.com. On there's plenty of videos and things for you to look at, testimonials, information. There's even on there, Ask Dr. Baker. You can write me an email. I'll get back to you.
You're hooking our viewers up too?
Yeah. Today, a special for anybody that's watching the Your Carolina show. If they call in and mention Your Carolina, I'll do a complimentary exam and consultation to see if we're a good fit and if I can help you.
You are awesome. Thank you so much. Please come back again. This was fascinating. Loved every minute of it. We'll put this on our Facebook page too.